on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. now at Stevens Greenhouse in Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse in Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse in Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse in Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse in Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse in Floral, the final days of our holiday clearance sale. Going on now at Stevens Greenhouse.
Okay. I need a roll call. Go ahead.
Okay.
We'll open the Beaverhead County City Board of Health meeting today. Start with roll call.
Megan Evans. Here. Charlotte Quist. Here. Nicole Hazelbaker. Here. Mike Placken.
Here.
Rush Lamont. I know.
He's gone.
He sent us a thing saying he needs to be excused today.
Yes.
And we still don't have a Lima appointment.
Yeah, Carla's still.
Is Carla still on there?
No, is she on here?
Oh, she's here. Yep.
Oh, excellent. Thank you.
Yep. She's on.
Okay. Thanks, Carla.
Okay, and Tom Rice.
Here.
Okay. Rest are technical and others.
So we do have a quorum.
I'm just wondering, is Lady Jones on?
Lady.
Yes.
Lady.
Yes.
Yeah.
But I just want to know for, and Carol Kennedy?
Yes.
Perfect. Ben Abbey?
Not that I see.
Kim Martinell?
Yes.
Okay. Aaron Montgomery?
No.
Okay. That works for me.
Okay. Okay, we got, and then we, topic in bigger letters on the agenda. It's reorganization of the board, if there is one, a reorganization. I need opinions and a motion, if you will, to retain what's here or whatever the board would like to do. Opinion?
Perhaps you should spell out what the existing organization is?
Okay, this is for the I'm chairman, Charlotte is vice chair, and then the rest are just our board members. That's the present organization of the board. And by retaining that, I need, if you want to go along status quo, I need a motion to do so.
So moved.
Need a second?
Second.
Okay, I got a first and a second to maintain the same organization of the board. Tom Rice president, Charles Quist vice chair, Tom Rice chairman, Charles Quist vice chair. All in favor say aye.
Aye.
Aye. Both same sign, motion passed. Okay. First on the public health update.
Yes.
May I just have a
Sure.
statement further on the record?
Okay.
That with the governor changing the things, I don't think we can just close and say Zoom only anymore.
Well,
Although face masks are allowed, I don't think we can close to the public. I know we still should do safe
Where?
distancing, but when I look here, I can see the public, a lot of them can sit here and be safe distance of 6 feet.
well, I'm going to start. Number 2 is the discussion and action of the governor's Gianforte's directive dated January 13th.
Okay,
We, at this time, we passed the directive from past Governor Bolduc. Those are now, if we get into that discussion, and we'll talk about Governor Gianforte's directive, and if we adopt that, yes, that's then my opinion that if the rules change, we'll change on number 2 on the agenda.
okay,
Okay?
I'll wait.
All right. So public health update.
For Beaverhead County, we have a total of 831 cases. Right now, we only have 15 active cases, so they have really dropped. Why that is, I think a lot of it is we are not doing much testing at all. Our testing has dropped a lot.
Excuse me, Sue, why?
Not sure. I don't know, do you have an opinion?
I think it's a combination of things. I think a lot of people some people don't want to, I think is one of the reasons. I guess I don't know any others off the top of my head.
So it's not that you're unwilling or it's unavailable or
No.
anything had changed in that, you just don't have as many people coming forth and requesting?
Yeah, not quite sure what's going on there.
That's a little good and a little scary.
Yeah, so I mean, it's great that the numbers are down, but I don't know if that really is representative of what's going on in the county. And I've heard that's happening in other counties as well, that the testing is way down. So anyway, we have a total of 38 hospitalizations. We had 1 discharged and 1 admitted today, so we do have 1 current hospitalization, a total of 8 deaths. So that's kind of a dashboard of where we're at in the county as far as COVID cases.
Any comments from the board as far as the public health update? Okay,
Perhaps,
Sheriff.
perhaps with the decline in the number of tests, should we let the public know what the parameters are for being tested? Put that out there so that they're not fearful to come and be tested? I think that would just be the more public information we get out there, the better off we're going to be, and the easier it is for us to do our jobs.
Yep.
Mayor. Mike, Mayor.
Not saying I know any, but I've heard quite a few comments around town that why do you want to get tested even if you're sick? Because all it's going to be is everybody that you know or in contact is going to be quarantined. You're going to lose all this money. That you might even then not be able. Now, if you don't get tested, don't tell anybody you're sick. Nothing happens. You know, you could stay home, and most of them I've been hearing are going to stay home, limit their contacts totally. But they're not. It's the way we've driven this. You're just asking, when we do these requirements like this is gonna come out and happen. So, I'm not saying it's good, but I'm just telling you, this is what's happening.
I think the one argument I have against that is if you are sick, you should be tested because then you will not have to re-quarantine for at least 3 months. So you can say, well, I was sick, we didn't prove it. We need to, I say it's better to document it because then you get an exposure at school or at work, you don't have to quarantine.
And that's correlating that is if the disease goes into the second phase and becomes severe, it'd be better to know what healthcare system's dealing with
Exactly.
for proper pharmaceutical therapy.
Well, that would be where we let the public know about the difference in the quarantines. Right now, what I'm hearing is people are saying, no, I really don't want to because I'm going to be in a 2-week quarantine. When we know that that is not the case, there are different stages. So we need, again, I can't emphasize this enough, we need to let the public know what's going on and what's expected of them, or what they can expect of us as being Board of Health.
Yeah, and the quarantine, at least people can get out of quarantine earlier now with the newer guidelines. You can get out at day 7. So it's really not as burdensome as it used to be, but I just think it's nice because you can be quarantined over and over and over again. But if you've tested positive in the last 3 months, we're not going to make you re-quarantine. So that's a very big bonus to testing.
Then the question is, what's the best forum to try to get that word out?
I mean, we've done a lot of, excuse me, I'm sorry.
Go ahead.
Well, I was also going to say another part of it that's related is when you go and let's say you're tested positive, what is the standard statement? Go home. So they're not getting anything out of it. Instead of actually there's quite a few drugs out there that will lessen the effects. We're not doing that. I know that for a fact. The doctors say we're not doing that unless you get really sick. Then they'll start treating. From the research, that's way too late on a lot of these. You got to give them the drugs. And one of them is hydroxychloroquine. That could help. CDC has removed all those restrictions on it. You can do it now. There's doctors out there doing that, and that's helping. It's lowered the severity of the disease. It has lowered the length. It lowered how many times you might have to go to the hospital. It works. But all they do is say, go home unless you get really sick, then come in. So they're sitting here seeing what's happening, and they're making the statement, why get tested? Why even find out? Because nothing's going to change. I'll just stay home.
I just think that's a really unfortunate blanket statement to make because that's really not true. When people test positive, our contact tracers have extensive discussions with them. Their medical professionals have extensive discussions with them. Some people we call every single day. The data just isn't there on hydroxychloroquine. The medications that do have data, like remdesivir, are available for our patients. It's like Decadron as well. The reason CDC doesn't have hydroxychloroquine is the data isn't there. It's too risky, so that's why people are not getting it. If there are monoclonal antibody treatments available, but there's not great data on those right now either, so those are not routinely being given. But if people aren't sick enough, they don't meet requirements for any of those medications. So being home is the most appropriate treatment. So,
Well, how about Z-Pak?
that's an antibiotic.
Well, it's an antiviral, isn't it?
It's not an antiviral.
No?
It's an
How about
antibiotic.
giving some antivirals?
No, it does have some anti-inflammation effect in the lungs as well, but it's not an antiviral, and there is no data for using it with COVID unless people have a secondary bacterial infection.
Is there any,
Stephanie Osborne would like to say something.
what's that?
Stephanie Osborne would like to say something.
Okay, yeah, go ahead, Stephanie. She got her mic muted.
Hi there.
Yeah, hi, Stephanie.
I have a question
Go ahead.
about referring back to what Dr. Evans made a comment about you have to prove that you're not sick or that you have been sick but you don't have to quarantine. Is that a rule, a suggestion? I kind of want you to elaborate on that a little bit more.
So, yeah, so the current guidelines are that if you've had COVID, that we think there's good enough data that you're protected for the next 3 months. And that's why if somebody is re-exposed to COVID, say you have it, 2 months later you're exposed, we don't re-quarantine you within that 3-month period. So that, I guess, is the benefit to testing.
Okay, the guidelines. The guidelines are from where?
CDC.
The CDC. Okay, so that's not, I guess I just wasn't sure. It kind of sounded it was you want people to get tested so that when they do get exposed to somebody else who's positive, that they don't have to quarantine.
Yeah, so they
Is
don't
that
have to
correct?
Yeah, you don't have to quarantine over and over again because we've seen some people keep getting exposed. But then if you've had it, that's the benefit to testing, is then you don't have to re-quarantine on exposure. So it does really help you out as far as your job and things like that.
Okay, all right, thank you.
Yeah, thank you, Stephanie. Yeah, is there anyone else on the Zoom today that would like to comment? Okay, Sue, you had your hand.
Yeah, and I think the important piece about this is also we want people to test, and if they are positive, of course, that's where the contact tracing comes in, so we can reduce the transmission rate by identifying those contacts. So there's that whole other part of, and a very important part, is to identify those people, so they don't go out and inadvertently continue the spread. I mean, that's the whole point of it. So,
Okay. Hannah?
Rich Russell.
Yeah, Rich. Rich, do you have a comment on Zoom? Rich Wassel?
Thank you. I just had a question as far as the public health update. Is there a dedicated number now for the 1B group?
Oh, like how many people are in 1B?
No, is there a dedicated phone number now
Oh.
for the 1B group?
that is for the vaccine, yeah, and I'll talk about that later down on the agenda.
Okay, if I
For vaccination.
wanted to exit now, could I get that number?
Yes,
I have three.
it's like, what is it again?
It's 683-3203.
Thank you.
Okay, thanks, Rich. Okay, anyone else on the Zoom have a comment? Okay. Thank you. Okay, the next, I've got discussion and action, Governor Gianforte's directive dated January 13th of 2021. And this came out recently, and then we had this Board of Health meeting scheduled. So I put it right at the top because the last few meetings, passed the directives in regards to the past Governor Bullock. And this is the recent ones that came out. I did receive some calls from 4 calls from businesses asking me about if we were going to address this new directive. And also we got some calls from some individuals around about possibly attending the meeting or coming in on Zoom again. They've been in on Zoom, some of you heard. They're on Zoom, they're participating in the meeting on Zoom. But with the directive that allows a few more people to come in, it's still, we can control that. So I'd like some discussion on Governor Gianforte's directive, and then to satisfy my calls from businesses and the public, we should adopt it or not. That's what I'm hearing. So,
Tom, just to make sure we're all on the same page, if my recall of that directive is accurate, the mask mandate stays in effect.
yes.
The restriction on group size is vaguely recommended. There wasn't really a number put on that.
No. That's why I say it's kind of your choice as a business, how many you want to let in or something.
And then what did he say about restaurants and bars? I know he raised the restriction on the 10 p.m. limit, but I didn't get a clear vision of what his assessment. Again, it's almost like he was tossing it back to the people and say, oh, they'll use their best judgment.
So the two things he eliminated was on the bars, restaurants, casinos, blah, 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 was the hours of operation, so that 10 o'clock is gone. And the percent of people they can have in their restaurant. It was down, what was it, 50% or whatever it was down. There's no restriction to that now. But they're supposed to come up with their own policies and how they're going to adopt public health recommendations, because he didn't say those were eliminated. He said you had to adopt those or adopt the industry standards for those public health guidelines.
Mike?
I think he pretty much threw everything out with the idea you still have to safe distance. So if your bar or whatever can handle 50 people in there, as long as everybody can safe distance, you're good to go.
There was spatial separation.
Yeah.
You have to have the spatial and the mask. I agree with the mask, that he didn't change that much at all.
That's where I misspoke. That's right. In the wording, they mentioned spatial separation in your business, or like in here, we could maintain special separation in here. Like every other pew, and the ends of the pew, I guess you'd say, 6 feet. So we could handle that in here to a point. But if it started to congest, we could say no. And then those that appear here, like a lot of them do, appear here at this time.
Again, to me, that raises the question, and I think this needs to be a discussion. How can we stay within his vague guidelines and still keep our population safe, our community safe? I think to just say all the restrictions have been raised, have been lifted, is an inaccurate statement.
Well, yeah, and it's not worded like that in the
Yeah.
directive. You know, you gotta read the directive to understand. You know, you can say, Tom's got a business, or people come in and eat or have drinks or whatever. I, as a business person, should maintain the spatial separation. And I, as a business person, would do that to protect my own liability. You know, even if because liability is what it's all about, I swear, nowadays. So that's the way I read it. So, you know, I'm the chairman speaking up here. Anybody have anything to add, please? You have something, Sheriff, to add or not?
Sure, I'll add something to it.
I could tell, that's why I told you.
You can see that, huh? Maybe the mask isn't big enough.
Gotta get a mask.
We need to put it.
It's important, I think it's greatly important that we, again, put forth an effort for separation. To show that the public that we're willing to follow our own guidelines and guidance, if you will. So it's my understanding that the Judge Berger has set some guidelines for the use of this building here. So in that, I don't know, I have not seen it, I just understand that he did that. So I would think that we could find out whether or not he put an occupancy loading in here under these conditions, and I think we could probably follow that, and or if he hasn't come up with an occupancy load based on social distancing, that we do that and allow X number of people in here and move forward with it from there.
Yeah, I think goes without saying. When he came to us and asked about these staggered pews here, you know, they're 6 feet apart down through there, and then on the end of the pew, they put a mark. So it is addressed visually almost here at this time. You know, the extra pews are leaning on against the wall over there. So that's helpful. And if we did, like next meeting, just knowing him like I do, but I would put marks on each one so they set correctly. But then when we reach that max, that'd be it. Go ahead, Michael.
The other thing is, I don't really believe the judge has the authority to do any of that.
Well,
He has the authority to do it when he is in his court. He can say, I only want certain things, he has that. But he doesn't have the authority over this building. Commissioners do, but he doesn't, you know. right there, I see that's 6 foot distance to the pews. You can at least get 2 and not 3 without, I don't have a tape measure, but
Yeah,
I know you can at least get 2 per pew,
exactly.
maybe even 3, no more than 3, I'll go there. But I see quite a few of them back there empty that we can actually put people in.
That's true.
But then limit, I'm not disagreeing with you that once you hit the limit,
I mean,
then that has to move out.
when we asked the judge about using this area, it's, however, it's his kingdom, if you will. And I know that's a poor word to use, but it is his, you know, and he's a neighbor in a sense. So we come upstairs, true, we own the building, but it's his responsibility up here to run his, just like a department head, however he chooses, as long as we agree, and we agreed with what he wanted to do. I could say that. I'm speaking as one commissioner saying that.
Understood.
The commissioners just designated the judge to be able to have.
Yeah, I mean,
His
it's
decision
his
to
area,
which
you know, and again, it's a liability thing,
Yeah.
so, but.
I guess I'd be curious to hear if you know what any other counties are doing. I haven't really heard anything.
Well, there's numerous counties that run the Zoom like we're doing,
Yeah.
and then they have their, we have 4 Zoom meetings this week. And I've been in Zoom meetings, in fact, I was in one this morning, and it was a public thing, but there was not one board member, and the chairman was, everybody was at their own computer. And then you do the Zoom meeting, and then the chair asks for public comment, which come in from their Zooms, the public Zooms. So there really wasn't anybody convened anywhere over one to the room. It's amazing. There was 21, 23 of us on this Zoom, and they were in 23 different locations.
I mean, I guess as far as like adopting the directives though, like if other counties are doing different things, because it seemed to me like we can still be more restrictive than what he said. He
You know,
said
if we so choose, but
Yes.
like I stated at the start, the ones that called me
Mhm.
would prefer if we were all on the same page.
Mhm.
Then there wouldn't be any, you know, Paul said it time and time again, trying to enforce it when, you know, you're trying to enforce the ones that in the past and down the road 20 miles, whatever, in the next county, it's a different thing.
Yeah.
You know, it's tough. Go ahead, Mike.
From what I remember, and I actually stated each time, that any things that we passed was tied directly to a governor's verdict or order, whatever you want to call it.
Direct.
And once those things went away, so did that order that we put out. Because we tied it directly to the governor's orders. And so in my opinion, whatever ones that were still in effect or in effect, I mean, the governor's orders, like for mass, mine keep falling off, sorry. But, that those are in order, but the rest of them, they're gone.
So what?
And I don't believe we have the authority to make anything stricter than what we should follow what he
He
puts
did say that
out.
we can.
Yeah,
It did say, you know, it kind
Said-
of comes back to that, like Bozeman, Missoula, and places like that, but it falls back on the ordinance thing.
And we don't
And if
have
we
an
don't have a
ordinance at
single
all,
ordinance,
all
it's
this is.
not one. You know, but Bozeman, Missoula, I can't remember, there was a couple
Gallatin
of,
County is
couple of
going
others, they have
to
some
keep
ordinances that support.
the former.
The former?
Yeah, that's what I understood.
Gallatin staying.
Go ahead.
With respect to our meetings in this room, I make a motion that we follow the restrictions that Judge Berger has put in place, just so we're all uniform with respect to use of this room, would not be confusing. So therefore, I make a motion that we follow the same standards the judge has with respect to our meetings within this room.
I second.
May I have
Comment?
clarification of what those orders explicitly are?
That, there's nothing in print.
So there is no
You know,
order.
there's no, it's just as a, when we came up, he had different trials and stuff going on in here and different things. So he placed them up there and then somebody at the door, you know, they set accordingly, just like somebody pointed out.
Aren't there X's or something on there?
Well,
No,
they're-
they didn't do it.
They'll do it when there's supposed to be a gathering. They'll put X's on. And when we first started, there was X's.
Yeah, we did.
Yeah, we put X's on. And if, you know, if we adopt the governor's rules, we'll get with the judge and then we'll just put X's down through where people can sit and that's how it'll act. And I'm sure, oh, 3 out of 4 of them mentioned, they will maintain their spatial distance in their restaurant, eatery. It's just the fact of maintain the special distance, have the extended hour. Some of them close down because people aren't coming through the door after a little while, at a strictly a restaurant.
I guess I think the thing I'm more concerned about, I'm not so concerned about like letting businesses have regular hours or, having as people in the business as long as they're spaced. I'm a little more worried about like the larger gatherings that then we're gonna start seeing, sporting events and other things. Like I think we've got to put a number there.
But those sporting events things, that, in my opinion, has to go before the school board and things like that. They're the ones that.
Well, I think we
governing body.
can, I think we can adopt standards more restrictive than the governor's with respect to allowance of
For real
larger
large
gatherings.
events, because that's far over 50 or 50 people at one of those things.
Yeah, so that's what I mean. I think we need to figure out what that looks like because it's not like the pandemic isn't over just because I'm PG and Forte says let's do all that. It's still
I don't
here.
know. As a directive, I don't have my copy with me of the directives. Go ahead, Mike.
On the making it stricter, remember back in July, we had a person stand up and wanted to find out, do we have the jurisdiction or to make anything stricter than the governor has put out. And I would be agreement in that position. And I don't think that has ever been answered for 6-7 months now. And he has his position out there. He wanted us to show where we have the power to go. It's easy to make a statement that we can make it more restrictive. I don't believe we can.
Well, the governor said we could.
No, he didn't. He said that if you have the authority to do it, you can. We don't have the authority.
Ordinances behind it. We can't, poor Paul, he can't, and Donnie there, or who's on the screen, they can't enforce anything because there's no ordinances behind it. In order to.
That's what I said. You have to have ordinances in place. Bozeman can do it. They have ordinances back now. Missoula, very questionable. I don't think they even did that right.
I don't know how the processes they went through, but that's irrelevant. The ordinances are on their books. Maybe they did it incorrectly. Who knows? That's illegal.
Well, the board certainly would have the authority to make strong recommendations against.
You can make recommendations, you just can't have any.
It's just that those two there can't do anything.
I know, but haven't been able to do anything about large gatherings up until now anyway, so.
Yeah.
But the only thing I am trying to argue is that I think as per the current governor's current directives, he said he did allow counties to be more stringent. And all I'm saying is we certainly could make strong recommendations against those gatherings and hope and pray that people abide by that for the sake of community health.
I suppose you can recommend anything. It's
I know, but that's
important is can't enforce it.
I know.
So,
No, but how many weddings, how many other things have happened over the last 9 months that,
lots of them.
yeah.
So,
But I would rather have the board say something, make an opinion on it, rather than just say, you can do whatever you want, because we know how that'll work.
Okay. So, with that said, on this, my thoughts of putting this on the agenda is number 2 on here is this Governor Gianforte's directives. I would entertain a motion to pass it as written or something to that effect, and possibly a note on there recommending large gatherings or something like that.
Cindy, for the
We
sake
have a
of,
motion.
Just a sec.
We have a motion.
yeah, I know, that's what I was gonna say, for the sake of the fact that I put a motion out earlier, let me amend that motion, and if my co-conspirator here goes along,
Let's see what you got.
let's say, that we recommend to adopt Governor Gianforte's directive as written, with the caveat that our board makes strong recommendations to the public that group sizes continue to be restricted. I don't know if we want a number on those. And strongly encourage businesses to maintain social distancing protocols.
May I help you phrase it?
Yes, you may.
How about just saying you go back to the old governor's phase 2?
What, we make recommendations
We
that,
follow this one, but we use the old governor's phase 2
as guidelines,
strongly recommend.
as guidelines?
Yeah.
I like that, Mike. Thank
Those are
you.
much more detailed, and they have better number data too.
But it's just the strongly recommend you follow phase 2, but we are adopting the governor's, the current governor's directive. Oh, is that okay, one?
What was in phase 2? I don't remember.
It's 75% for restaurants,
What is,
and I can't remember bars too.
yeah, what does phase 2 say?
Yeah.
Because the normal language in statutes is that you can adopt or make rules that are stricter. You cannot make them that are less restrictive.
Yeah.
So if what he says, and I've got the directive up here, what he says is to follow or to accommodate CDC social distancing guidelines.
There you go.
And I think that's better language than trying to go back
Okay.
into the future. I think adopt this 2- what is it? They're calling it 2-2021 Governor Directive. Directive implementing Executive Order 2-2021. And then that establishes the new guidelines for social gatherings and institutes the mask mandate and follows that CDC guidelines. So that if something comes up that the CDC sees fit to change those guidelines, then we're kind of covered and we don't have to scramble to make adjustments.
I like that.
That's a good point. Cindy.
Could
you read that back? Isn't that
Okay,
So Cindy, I think it would be that we will follow the current governor's January 13th directive with the caveat that we would strongly encourage businesses and community to follow CDC guidelines. And you can put the number that Paul just rattled off with respect to social distancing and social gatherings.
Group size. I
Group
think
size.
what group size.
okay, so what I have, your first motion, is that going to be quashed or amended?
Amendment.
It's amended.
Okay. Amended to, Charlotte amended her motion to, the board recommends to adopt Governor Gianforte's directive, Governor Gianforte's January 13th directive as written, with the caveat that our board makes strong recommendations to the public that group sizes continue to be restricted and strongly encourage businesses to maintain, that's where I stopped, social,
CDC guidelines.
CDC guidelines.
okay.
As per CDC guidelines.
Okay.
Did you want that number?
And Mike suggested that we go back to the Governor Phase 2-2021 directive with new guidelines for social gatherings.
That was Paul.
Paul?
No,
And no, that was,
20.
that's the CDC.
that's the,
2-2021
That's what I said.
is the directive that we are adopting, not last.
Go back, okay, okay.
That's not the one from 2020. Put it that way.
Yeah, it looks like the one from 2020 had 50% occupancy when I'm looking at it.
Yeah.
And it looks like at one point it was amended that the bars would close at 10, and then they changed it to, it looks like that closure is all over the place, from what I can tell from the previous versions of it, so that
So-
old phase 2 is maybe not what we want.
So do we want Cindy to read that once more, just flow through it?
Flo? I'll give you
Just-
Flo, okay.
What, before you do, Cindy, excuse me, what's the group size on that? Do you have that?
It says that businesses face diverse challenges in this emergency and need flexibility to serve their customers in a helpful environment. Therefore, businesses should make reasonable efforts to develop and implement appropriate policies based on industry best practices during this emergency. Where no such industry practices exist, such policies should be developed and implemented in accordance with federal, state, and local regulations and guidance regarding social distancing, temperature and/or symptom screening, testing, isolating, contact tracking, in cooperation with public health authorities, sanitation, use of disinfection of common and high-traffic areas, and telenetworking.
So it didn't say anything specifically
No,
about
there are
groups?
no specific numbers in here on occupancy at all.
And that's, all you read is that 2-2- whatever?
Right, that comes directly, that's a quote directly out of the directive implementing the Executive Order 2-2021. What's important, and I have to point this out, what's important in adopting this specific directive is that in here, he implements state of emergency in Montana. Like was said before, once Governor Bullock was out, it needed to be reestablished, and he did that with this directive.
Okay. So, you, go ahead. Now, if I stand at the distance, can I ask you to do that
You
again?
understand? No, I can't. Charlotte amended her motion that the board recommend to adopt Governor Gianforte's January 13th directive as written, with the caveat that our board makes strong recommendations to the public that group sizes continue to be restricted and strongly encourage businesses to maintain CDC guidelines with, I'm not sure how I'm going to put that together. I put Paul suggested we adopt the governor's phase 2-2021 directive with new guidelines for social gatherings and re-implementing something. What'd you say?
Reinstating the state of emergency.
Oh, state of emergency, okay.
Okay.
I second that.
Your second.
Thank you. Never mind, no, but it sounds good.
Okay, I have a first and a second on the Governor Gianforte's directive and our amendments to that, additions to that. So, just all in favor say aye.
You got anybody in the public?
Well, this is a board decision here.
Yeah, you should by law take input from the public on all your items. If there's any out there that want to talk, in my opinion.
We didn't on the last go around.
Well, you took input.
Yeah, but not on this, because we're the board we're voting. So,
I think,
well, I could, I guess if you think so, but I don't think it's necessary.
okay.
So, it's already written here, so. On Governor Gianforte's directive, all in favor say aye.
Aye.
Opposed? Hearing none, unanimously passed. Okay, now with that said, on the next,
I do have two people that want to say something related to what's been talked about.
Okay,
So,
go ahead.
yeah,
No.
we're moving on. Randy Shipman first.
Randy Shipman, go ahead, Randy.
Hi guys, how are you?
Good, how are you?
Good, thanks for taking my call and also thanks for all that you guys do. I did want to say a couple things. And now you did already vote, so it may not matter, but I do hope, and I know you guys do, but I want to continue as a public school official to remind people that, you know, there's the public health piece to this, there's also the mental health of our kids, and it is not good, guys, and I know a lot of you know this, but our kids are suffering greatly, and I think that you know, obviously we can't do everything, as Stu knows, We just canceled wrestling. That was a really tough decision for myself and for our administrators and for our board, but we think it was the right thing to do. So it's not that I don't support, and that was, you and I talked about it, and it was kind of her recommendation, and we're completely, I took a lot of heat for that. We'll continue to take a lot, but I think that that's the right thing to do. But with that said, I just want to make sure we're not forgetting about the mental health of our kids. Our high school is now finally starting to go back. I still not days, Monday through Friday, but hopefully that will be soon. But it is in the best interest of our kids to get back to that as soon as possible. And I think when we start talking about group sizes and things like that, I just hope I hope we remember that and continue to think about that. And I know that our high school has been very responsible with their groups, with activities and things like that. I believe that we have in the elementary district too here, and we'll continue to do that. But I would hope that we could do all we could to try to, I don't want to belabor the point. We talk about it all the time, and you guys have heard it all the time. Our kids, are not suffering from this disease like our old folks are and things like that. I could share the stats of our staff and our children here if you wanted as well, but we're doing quite well, and I just don't want to forget about the mental health of our kids, and being able to participate in the activities and being in school and things like that. And again, I appreciate all that you guys are doing, and thank you for your time.
Okay, good. Thanks, Randy. Yes.
Stephanie Osborne again.
Stephanie Osborne. Stephanie, are you on?
Should be. She needs to there we go.
Yeah, hear me?
Yeah, go ahead.
Okay. Now I know you can go online to CDC and find the guidelines, but I felt like there was a lot of talk of follow CDC guidelines. Is that something, the CDC has changed things from day one of this pandemic. So as the CDC possibly changes, that's something that if it's going to be in this directive that you guys are adopting, that there should be information that is available to the public, because I'm not going to go to CDC every time to go do something and see if their guidelines aren't going to change. That's something that we can provide that information to the public so that they know what that is. I know, there's no specifics being said, and it can change at any time, as we all know. I just was kind of curious what your thoughts were going about making sure everybody knows what the CDC guidelines are.
Well, are they the length of what basic sheriff that you read? Yeah, 2-2.
The 2-
Yeah, but we put in the
2-2021 is the governor's directive.
governor's directive.
Yeah.
Okay.
But if you go to mt.gov and look at their COVID website, it will give you links that give you access to the latest CDC guidelines.
Oh,
And I believe that the public health has that same thing on their site also. So it's a matter of,
Stepping your way
when we get up in the morning and look at the computer for the news, well, why don't we look at CDC guidelines or those links?
Okay. Okay, Stephanie, well, thank you, and we'll make that, there'll be a source you can go to locally to go to that, get that information.
Okay.
Okay. Thanks.
Sue, I just have a recommendation. Could you possibly just have that readily apparent on your website, or a summary or something?
So the steps, how to do he's talking.
Steps how to access the website?
Yeah.
Is that what you?
Some kind of a link,
Just put the
something.
link to the CDC, that just copy.
Yeah, and I do have to admit, and that was one thing I would say, the website, we're not using our county website for getting stuff on. We have some things on, but as Kara told me, she goes, it's really old, it's from July, and that's the last governor's directive we had on there. So it does need, the updated information does need to be put on there, and we're working on that now that the cases are down. Hopefully I have some help that can do that for me. So yes, good point, we will do that.
Thanks, Stephanie, for that point. Sheriff.
We do have the press available in the audience. I would think that maybe we could ask them to publish that in their next edition for those cdc.gov or dmt.gov sites, so that people out there would have access to it.
Front page, Casey, yes.
Well, our website has a special COVID section. There are links that go directly to CDC and to Montana's website and all that. So, I mean, if they need the links, they're right there.
Okay, could you help guide the public by putting that, what you just said, in today's summary of the meeting?
Sure.
That'd be great. So then when they're reading the article, they can come to that right away. That'd be helpful. Thank you. Mike?
Now, what we actually started this discussion on number 2 is letting the public come in. And that's still open.
Yeah, I will let that next meeting, just like I said. Not this meeting, but next meeting, just like I said.
Oh, you're gonna put it on next meetings?
At this, with this passing this way. So,
Yeah,
okay,
we
this
didn't-
next meeting,
we never
this
made it.
agenda never states anything about public.
And this agenda was we never voted to restrict them.
You know, they never said.
Well,
But now suddenly they're being forced out by the sheriff.
Okay.
Well, now we're allowing them to come in. Mike.
Okay, now they can come in and I'm okay. As long as they say.
He's in.
He's in.
So anyway,
Okay.
go ahead, Sue.
So, with our adoption of the governor's directive,
Okay.
and, okay, so I guess, and Paul too, but, so, for instance, let's have a bar that is now doing absolutely nothing, it's cram-packed full, there's no social distancing, there's nothing, public health wise going on at all in that. So what do we do about that? Are we still basically saying nothing? Not gonna do anything about it? And
Well, that does basically violate the governor's directives, because he said that you should abide by, continue to abide by social distancing. So technically, I would say that doesn't follow his directive, but enforcement remains a thorny issue.
Enforcement's a huge issue with no ordinance.
Dottie, do you have anything to add? I mean, you know that I have concerns about that because I get complaints all the time and I don't know what to do with them.
Well, I'm kind of with you. I don't know what to do. I still don't think it's really clear. I don't think anything's changed in that aspect because there's a new mandate or anything. It's still kind of up in limbo. I would like to be able to at least inform. I mean, that's what we've been kind of doing, but I think it's that point where you can inform all you want. People can do what they're going to do one way or the other, and now move on to enforcement thing. I don't know how that ability. I guess maybe reaching out to the AG office would be the best way to handle it, but I don't know. I personally don't feel comfortable right now with, I'm still in the same boat. I haven't seen anything different for me about the enforcement issue.
And so when you're talking about an ordinance, what would you have to do? To make it? What's that process?
Probably 2 or 3 public hearings, 2 weeks apart, on down the line.
It seems that, to get at where Sue's going, it seems that we probably do need to put an ordinance on the books, so in the future we have, not necessarily geared to COVID, but so in the future we don't have the same thorny issue.
Yeah. I mean, if that's what it takes, is
Yeah,
to
why
have
don't
an
we do it?
ordinance, why can't
We could
do that?
possibly,
and
but
then-
there's specific steps in the law.
Right, to do it, but
It isn't like pass it here and it's in
Right.
effect, boom.
Yeah.
I mean, it's down.
Well, obviously this isn't the body to pass it
No,
anyway.
and then there's there's 3 or 4 bills in the legislature right now that are doing that could change the way you do it. So the ones that, you know, to get it through, it might be changed in midstream, so it's a conundrum, whatever you want that word is. Mike, go ahead.
And also, since this is a joint city-county health board, to enforce anything in the city, you need the city to have ordinances. The county can pass their ordinance, and that can be done in the county, enforcement in the county, but not in the city. So the city has to pass their ordinances, very similar.
So
Lima would have to pass their ordinances if you're gonna do Lima.
So even if the city of Dillon is in the county, if the county passed an ordinance, the city does not have to follow the county ordinance?
That's correct. That is because we're an incorporated city with charter. We have self-governing powers.
That's what Gallatin
And they
Gallatin
can.
County ran into that with Manhattan, Three
Right.
Forks, Belgrade, all those don't have ordinances.
They have-
Bozeman does.
They have power out in the county, but not in the incorporated cities.
So can you, as the city and the county, get together and get some ordinances passed?
We
Start
probably
the
could
process?
start the process in the future.
Well,
If,
first,
you know, we'd have to
the
do it
ordinances
through-
other places have done, so we can read them
Read
and
it.
adapt them to ours.
You
Yeah.
know, and then
Start
there's,
the process.
Yeah.
and then there's steps, you know,
Yes.
especially this legislature is sensitive to lots of this stuff. And, you know, you'd almost see what that's happening, so you didn't get all the way into it, and then they pass the law and you change your steps and you start over.
Yeah.
I
But
think,
could we, as the board, at least ask the city and the county to start looking into that process?
Which
I mean,
we-
I think it,
which we have.
you know, who knows what the next,
Well, that's what I say, it's not just for this. I mean, it's something that's obviously a big
Problem.
problem, and we should be taking action to, down the line, help.
And which I've been at other county meetings, together county meetings, and they're talking about it. They're just, like I said, there must be 10, 12 bills about it, all different ideas, and how it all necks down to one bill that passes. Then you take that one, because it stands for a couple of years.
A bill on what?
Ordinances and
Oh,
all that kind
just
of, and
on
the
ordinances.
processes and
So
you name it. I mean, there's all kinds of different, there's 3,000 bills up there right now.
So we have seen through this year that we pass so many things here with our board, but then our law enforcement, it's confusing for them, or they want to help and support, but they don't have these ordinances to back them up. So the county and the city, one of our cities, is represented here.
Well, the other one's-
We are-
the other one's
she's
on.
on.
She's on too.
Okay, we're all represented. So we are asking for you with the authority to move forward in getting ordinances. Yes, it takes time. Yes, things change. We understand that. But how long has Dillon and Beaverhead County been Dillon and Beaverhead County, and we don't have ordinances? Let's get some ordinances going here to help our law enforcement, to help our Board of Health, to help all the other groups. So there's guidance, there's understanding, there's organization. Organization does wonders.
There's probably only about 4 in the state.
Well,
I mean, it's
but
amazing.
we
What you
can,
can do.
we're Dillon. Come
I know.
on, we're Beaverhead
We're
County, we're
progressive.
Dillon. We are progressive.
I don't know.
Let's be the lead in
And what we've
this.
done is, the mayor has the power of the health, not the city county health board. The mayor has the ultimate power.
Right,
And that's why we went for the city, not for the county.
yeah.
And I believe if you look, I'm not sure who in the county, maybe it's the commissioners together have the power of the whole health.
Too. I'm
I'm not sure. That one I'm not trying to
I would have to
speak.
really dive into that. So you go to the effort, it doesn't get thrown out or some darn thing. So, you know, you
I mean,
gotta-
so really, at the end of the whole thing, I don't like what you guys have done, I can just say, screw it, we're not gonna do it.
yeah.
And I have that power to override this.
Yeah, but you guys can work together.
We can work together,
Oh, yeah.
and I've been trying to work together
Yeah,
throughout this whole
I agree.
thing.
So work together,
Well-
put the ordinance together, organize us, help us. Help our right now, we have this that we just passed, and our law enforcement, they can't do anything
That's
that
right.
they would like to do to be able to help.
Well-
They can only go so far, and we need to support them.
We'll
And
look
have
at
ordinances
that.
in
We'll
place.
look into that. We'll move on to COVID-19 vaccination update. How's that?
Stephanie Osborne would like to speak again.
Stephanie Osborne?
Hi.
Yes.
Okay. And, I just kind of wanted to give my 2 cents. I've been to a lot of these meetings, not all of them. There's a lot of tough choices and decisions you guys have had to make. One kind of thing I just kind of am feeling from all this, I feel like we're not moving forward. With the governor's new directives, I feel like that was kind of a push to move forward, try to start, obviously opening things back up, getting people's businesses rolling again. We're getting the vaccine rolled out. It's all moving forward, and now we're saying, let's put some ordinances, let's put some more restrictions, and that's fine. If you guys vote that in, that's fine. But at this point, I feel like the general public is either, they're already doing what they're gonna do and they're not really gonna change. So I feel like, we're just not, it doesn't seem like things are moving forward to try to stop this pandemic. I feel like we're trying to smolder it and stay in it. And that's just, I'm not saying any specifics, but that's just kind of the feel I'm getting. I don't know if that's your guys' intentions as a board, but I feel like that's kind of what's happening a little bit, and that's probably what's upsetting a lot of the business owners and the public at this point.
Well, thanks for your comment. I want to move on to COVID-19 vaccination update.
Speaking of moving forward.
Yeah.
Yes.
I'm trying to get the pandemic to go away.
Yeah, let's get the pandemic to go away. Let's vaccinate everyone.
We got it. We've been
So
wondering.
it is exciting that we do have vaccines and we have started the process. We are just winding down with phase 1A, which are the healthcare workers, frontline healthcare workers, long-term care and assisted living facilities, and healthcare workers with direct patient contact or virus exposure. So the long-term care facilities, the Pioneer Care, they were contracted with Big Sky Management and received their first dose of vaccine. About 65% of the staff received the vaccine and about 88% of the residents received the vaccine. The assisted living facilities, which are the 2 Renaissance and the Legacy, they all were contracted with Walgreens, and they were all vaccinated on January 15th. Approximately 90% of the residents were vaccinated, and less than 50% of the staff
Was that by those people's, there were some people that didn't want it, is that why they?
Correct.
Okay.
Yep, it was offered to everyone. With public health, I received 200 doses for phase 1A, and right now we've done 90 people. I have 50 more scheduled for tomorrow and Friday that I'm just doing in the clinic. And then we'll start with phase 1B, kind of coinciding with the Community Health Center and Barrett Hospital, providing those like next week, starting then. I believe Beaverhead Urgent Care is also providing, or will be providing, the COVID vaccine for their patients. Before I go on, again, the logistics with this is very complex. It's not like a flu shot clinic. Again, those vials are frozen. They're very fragile. That vaccine's very fragile. So it's frozen. You have to thaw them, though I found out you can thaw it quite quickly with it in your hand. So, but they say an hour in room temperature, 2 hours in the refrigerator. Then once you puncture the bottle or the vial of vaccine, you have 6 hours to do those 10 doses. So you need to make sure that you have 10 people lined up, appointments, to give that vaccine within that time. The state has said if you have 7 people, that's, let's say, in 1A, and you have 3 doses, give them to anybody, just get them in somebody's arm, don't waste them. And so that has happened, and you may have heard, you know, people saying, well, why did so-and-so get that shot? They're not in 1A or that kind of thing. That's why. It's better to get it in somebody's arm and protect them than to, you know, to waste it. So that's happened. We have scheduled, we had a planning meeting last week, and we have scheduled 3 community mass vaccination clinics. They will be they're on Fridays, so January 29th, February 5th, and February 12th. From 12 to 5, they will be at the university's arena. And the first clinic, we're going to probably do about probably 250, because I need to do second doses. So I have second doses due already, and we're just going to fit them in that clinic. So probably 250, 260 doses during that clinic. We'll do a hot wash afterwards, see what works, see what didn't work. Can we do more vaccines in that time period? So we'll determine what we'll do for the next clinic. It may be more shots, which I think we may be able to do that. Right now, the way we've got it planned is we would have 4 vaccinators. So people would come in, we would have 30 to 40 chairs spaced out 6 feet apart for these people to sit in. Once we're ready, they'll go up to the tables, the front tables, where we'll have a couple of people looking over their paperwork, making sure everything's completed. They'll complete the little vaccine card. Then they'll be sent back to the vaccinators. They'll be vaccinated, and then they're sent back where they will sit in chairs again, which makes this also complex, is they need to wait at least 15 minutes for adverse reactions. We are planning to have EMTs there with an ambulance available. And then they'll leave. So it'll be kind of a constant flow, is our hope. We have a meeting on Monday to work through the flow and exactly how many people we have to help us out. We are relying on some volunteers. The college has several people that will be helping us. The hospital has some people that will help vaccinate. So we are leaning on volunteers. And so if anybody is able or would like to help with some of these clinics, please get a hold of me. You can call 683-4771. I've had lots of people already calling. I've got them on the list. So I really thank everybody that's provided their support with this. Then we have scheduled the second dose clinics for these people, and they will be February 26th, March 5th, and March 12th. These second doses are what's really, to me, it's causing the problem of trying to get so many vaccines out to people. Because now we've gone through almost 2 months and we've only given 600 plus doses to this group. So we really need to have more clinics, but it's so resource intensive that it's hard. I mean, if I didn't have to do any of my work, other work, I would do it every day. I would do clinics every day. But, you know, we all can't do that. So, you know, I'm asking people to please be patient with us. We're trying to figure out the best way to do this and to get this vaccine out. I know CHC is trying to do it within their clinic time. I think the hospital is looking at maybe doing, and Carol Kennedy, you're on here still, right?
She is, yeah.
Hey, Carol, can you speak to what the hospital's going to do?
There we go.
Sure. We're just starting to give our employees their second dose. So like you said, it's really time consuming and different than other vaccines. We had one pilot clinic with patients So we randomly pulled 30 patients that meet that criteria for 1B. Well, actually, no, we're a little more stringent. We started with patients who were over 70, and that's a little more strict than the 1B criteria. So now we're repeating that, and we're trying to figure out how many people and how many hours it will take to do 50 in a day, and then can we move to giving 100 vaccines in a day. Well, as soon as you get 50 one day, a month later, you're going to double that because they have to come back for their second dose. So we're working on all those logistics. We're getting more and more people trained to give the vaccine. So we currently have 8 vaccinators who are also going to help with the community events. But within our clinic, I think we can identify some more people to get trained and up to speed to get more vaccinations quicker. That's our whole goal, is to get everything we receive into patients' arms as fast as possible.
And one thing regarding who can vaccinate during an emergency, dentists can help give vaccines. There's some other ophthalmologists. I've had an ophthalmologist volunteer, so that's great. So kind of looking outside the box, who can help us with vaccinating. We can be creative with that. So if there's any retired people out there that still retain their license, if they would like to do this, again, let me know.
I've been known to give shots.
Hey, probably capable.
Should have been worried if I know.
Big micro here.
So anyway, we're working on that. Please, everybody, just again be patient with us. We're trying to figure out the best way to do this. We are talking about planning some rural clinics. So like one in Lima, one in Wisdom, and one in Wise River. That's as far as we've gotten. Don't have any dates. We just want to get through this first one and see how it goes. Again, these all depend on appointments because of that, getting those 10 people scheduled for one vial. So it has to be on an appointment basis. And so that's kind of puts a monkey wrench in it as well. But we haven't forgot about the rural communities. We will get out there. I just don't know when yet. But obviously they're in Beaverhead County. They can come to these mass clinics as well. With the old people, I've had people call, and the older people that may not be able to walk into the arena, we will have somebody able to go out and give them the shot in the car if they're not able to do that. So I feel like we have most of our bases covered, and I'm looking forward to it. It's exciting to get this vaccine into people. They are so excited, the ones that are getting it. I can't tell you how excited they are and elated that they're finally getting this. So also be aware we do have that dedicated COVID vaccine appointment line. Now we just got it set up today. So again, the number is 683-3203. Okay, please call that. We have people calling every one of our extensions, and sometimes we have 40 to 50 voicemails on there. Sometimes if they don't get the first extension, they go to the next extension. So we're trying to cut that out because it really is time intensive to try to get through all those calls. So if everybody could just call this line, it will be very helpful. It will be manned from 8 to 5, Monday through Thursday, not Friday, because we will be giving shots and everybody in our clinic will be helping. So we will be.
What is the line called again? Dedicated?
It's a dedicated phone line for COVID vaccination appointments for these community clinics.
Okay. Next, I have community intervention implementation plan. And then the bullet points are required PHEP deliverable, focus on 3 goals. And Sue, do you have handouts for that?
Well, I sent everybody what I had. So this is a requirement. It is a deliverable that is due with our emergency preparedness grant. And that we need to meet with our partners, and they named the Board of Health, which is basically our partners. We've got CAC, we've got the hospital, we have the university, we have law enforcement, so we have pretty much most of our representatives from our partners. But anyway, I had to call on it because I wasn't really sure what to do. So I called the state, and basically they wanted us to determine how we would really implement all the non-pharmaceutical interventions. And those are what we've been doing, the social distancing, the reduced numbers, all those sort of things are non-pharmaceutical interventions. We have a plan for that, but it's just a real broad plan about what it is and that we'll institute it, but it's not like saying this is how we're going to do it. Experiencing the pandemic has really put to light what's worked and what has not worked. And so they just want, it doesn't have to be anything in depth, they just want discussion on these types of things and with our Board of Health, and just kind of help me have a framework of how I can write this plan. So that's what it is. It doesn't sound very exciting, but as I spoke with the guy from the state, it is important. So we need to not lose the lessons learned from this, and we need to get it down and what the best way of doing this is.
Mike? 2 points, questions, whatever. The first one is this due.
This is due at the end of April. The report is due April 15th. It's for this quarter, January, February, March.
This implemented plan report.
Yes.
That you said.
Yes.
Because I'm really nervous. I mean, we just seen this yesterday, and the public didn't have a chance to even see what any of this is about.
Well, I don't know if that's necessary, but
It's more of just a plan
It's
for
just-
future use.
yeah, exactly.
And the state requires a lot of these kind of plans to be written out for
Well, not
COVID preparedness. right?
And I'm not disagreeing with that. I'm
We're not
saying
voting
this is
on
a
it.
public meeting. This is a public board.
But we're
And
not,
before we put out any requirements or any
It's not a requirement.
procedures or what we're going to do, we should have the public's input on what they might accept.
there's no requirements.
No.
It's just like
Like a
what
sur-
worked best, what worked well, what's our assessment on, how,
It's
what
like a
worked well.
survey.
It's a discussion.
It's
Yeah.
a discussion. Oh. So it's a
And looking forward to the
community
next
intervention
one.
implementation
What do you
discussion.
need from us?
I need help. This should not be Sue's plan. This is a community, this is how the community would respond to, let's say, when we have another pandemic. What worked in implementing these
So,
things?
in
What
other words,
didn't work?
Public putting in, is what I just said.
Well,
I mean, that's where the public should
so
be
is the
telling us.
local emergency planning committee, but we
So-
don't,
Today we just
it's just discussion.
Today, we just get this information to the city and to the county and get it out to the people. So this plan can be compiled for you by April 15th. Is that what I'm saying?
Why don't we have a meeting 2 weeks from now?
Just separate of this.
It's out here and we can just
So
discuss and get it
invite
done.
Casey to write it all up. I'm winking at you. So we could have a separate meeting in regards to this. So, if you ask input, you want more than
And that gives us time to work on it and try to help.
I mean,
I'm not against this thing.
It's like the schools and that are on the.
Yeah, can we just have a committee or, a smaller meeting and just try to get this done?
Yeah, committee group, do it on Zoom. You might be able to schedule it in here and get the schools on here because they're a big part of that.
It's
Just
totally up to.
Go out, let's have a meeting, another city county health board meeting, 2-3 weeks.
And
Give everybody time to talk and see what worked, what didn't, whatever.
After we got.
We will come back and this is the only item, let's answer it, get it done.
Well, that'd be great if it was the only focus, because I feel like we're kind of running out of time too.
Yeah.
But,
Yeah, I think that's a good idea.
Because you got 5 bullets here, in a sense.
Fun, if you actually read through, which again, I agree, I didn't make it through all of it. this
I would
time,
not expect anybody to read that.
But I got through it kind of fast. And I couldn't answer a lot of it right now without thinking about it and talking.
Yeah. So, with that said, go ahead.
Rich Wassel has been on waiting to speak.
Okay.
So,
Okay. Rich, we're on this community intervention. Is that what your comments are on? Rich Wassel?
Well, actually, I had my hand up in item 3, but I'm kind of zoomed into number 4, pun intended.
Okay.
Can I ask my question as far as item 3?
Go ahead.
Not to get into the weeds, but as far as the Moderna vaccine, and I guess these questions are primarily directed at the county health director or Sue Hanson. What exactly is the window that the second dose has to be, time window that it has to be administered within? And then, second question, what exactly is going to be the coordinating vehicle for making sure that, I guess, everybody somehow automatically or magically gets appropriately scheduled for their second doses? And then, third question.
Well, how about, Russ, why don't we just answer those two first? Dr. Evans, Dr. Evans, you got it?
Yeah, so the timing for the Moderna is 28 days later. You can do it, I think, 4 days in advance if you needed to. And say somebody misses that 28 days, if you want to give it delayed, that's okay. You should still get your second dose even if it's, say, 2 or 3 months later instead.
Okay.
So, and I think as far as the planning, what we're doing, that's what, like when we're doing the mass clinics, we're putting people in that first clinic and then we're just going to schedule them to the clinic that's 4 weeks after that. And we're doing that at the hospital and clinic level too. People do get a vaccine card when they get it. And then we also are uploading it into the Montana immunization system in Tracks, which will help track it too. So if you get your immunization somewhere else, we can see that really easily throughout the state. So it's still probably going to be somewhat on the individual though too to make sure they come in for that second shot. But I think we've got a good system so far.
Okay, question 3, Russ?
Rich, so 24 to 28 days is the time window for the second dose optimally. The system's going to be set up so that people are going to be essentially automatically, if I understand you correctly, scheduled for an appropriate second dose within that time window.
Yep.
What is the situation as far as if Murphy shows up and somebody either isn't properly scheduled for their second dose within a couple of months window, or refuses the second dose or whatever? Is there any partial, and if so, what objectively is the partial coverage of the first dose?
I think that's pretty preliminary. What I have seen is they think by 10 days after the first dose, there's somewhere in the 70 to 80% protection, which is really good to hear. But what I think the importance of the second dose is that I think it might give you a more durable immunity, which means it probably lasts longer than just getting one dose. But I think they have to look at the studies a little bit more and get a little bit more data to say how protective that first dose is. But I think there's really promising data. I'm sure there's going to be some people that choose not to get the second dose, and that's going to happen. And there are going to be people that might have strange circumstances where maybe they got the Pfizer and now only the Moderna is available. And we'll probably get guidelines from the CDC about that. I know the WHO said it's okay to mix if you have to, but we'll probably wait for the CDC to say something like that. We won't have the Pfizer here in Beaverhead County, not likely. We'll just have the Moderna, so that shouldn't be too much of a problem unless somebody's coming from another area. But I think we'll know more as we get more data too, so.
Okay. Thanks, Russ.
Okay, well, thank you very much.
You bet. Okay, Russ, on this community intervention and implementation plan, you spoke of having another quick meeting here.
Separate meeting.
A separate meeting. Do you want to set that date? And how far away would it work for?
3 weeks, as far as I'm concerned.
Yeah, not too far out, don't do it anymore.
Okay, how about-
Of course, I'm thinking of had one with you with
How about the
vaccines.
first week of February sometime?
With your vaccines, your clinics next Friday, Friday after,
Oh,
Friday after.
Yeah, right.
That might be tough for 3 weeks with you then.
What about a Wednesday,
Wednesday to what?
3rd or the 10th?
3rd of February?
Yeah, or the 10th.
Wednesday, the 3rd of February to the 10th.
Will this be a health board meeting or a separate?
Yeah, but just one item.
Committee?
Just the community intervention
It's
implications.
just this
Call
topic.
it, could call it a
Number
committee
4.
meeting,
Working.
working meeting.
It's just a working meeting on this topic.
That would work for me.
Works for me.
Okay,
Say it again.
what was it?
10th of February?
Oh, 10th or 3rd?
Oh, I don't know, which one did you say?
How about the 3rd? It's sooner.
3rd, okay. Works for me.
What time?
I like 2 actually myself.
Can we actually do them a little earlier because we have like state meetings at 3
Yeah.
o'clock?
Yeah, I've got a 3 o'clock meeting I'm missing too.
How about 10 o'clock in the morning? Or 9 o'clock in the morning? 10 o'clock could be.
Is that too
10th
early?
works for me.
10 o'clock, Wednesday, February 3rd.
Okay.
And a location.
County
I-
Commissioners room.
I could
if it's
check
a
the
small-
commissioner room. And see, I don't know, but I would guess I could probably, it's probably open, but I can't firmly say that.
Public?
What's
Is
that?
there going to be a lot of public?
Well, and, you know, if,
This might be open
It-
too.
It's a
Well, I-
board of health meeting, so if we're saying the public's going to be.
yeah, it'll be public. There's no doubt it'll be in the
Yeah, but
commission
there's
room,
no-
and I haven't checked this schedule here.
Right, well, we check that and then if it isn't, we can try to find another place.
Okay,
Our
I'll check.
calendar is down, I can't tell you guys anything. So
Oh.
our
Pardon me?
calendar is not updated.
Oh, the calendar isn't
It's
updated
down.
yet for that, so. But I'll-
Location to be announced.
the
Yeah.
Location to be announced. How's that?
Randy Shipman wants to speak again,
Okay.
so I don't know if it's about the.
Yeah, Randy.
Tom, I was just gonna say, if you guys ever need a place to meet, I will make a room available here at the school district, so just let me know.
Thank you very
Very good, we
much.
found one.
Well,
Thank you.
And they have Zoom.
And you have Zoom in that area?
Obviously. He's on it.
You, thanks then. I'll bet he'll make it available.
Anyway,
Especially at our request. Thanks, that's all that. Anyway, we'll go, February 3rd at 10 o'clock, is that what I heard? 10 o'clock. And the location to be announced after we get set up. And that, and Randy's.
and then if you could maybe throw out some suggestions that you might have already, Sue, and then we can work from there and put what we think then.
Or you can shoot it to us all in the email.
That's what I'm trying to say.
I sent an email yesterday, late.
Right.
But it sort of had like this discussion topics of sort of some things that we needed to talk about.
Okay,
So.
perfect.
And then this is really good guidance, so get a chance to look at
So Sue, my email is now working. If you could-
that. Okay, I think I'm going nuts. Okay.
Okay, that's, we'll move to this House Bill 121, and the Board of Health, I had a clarification on this, Sue. This is, we have to be ever so careful about doing this. You know that this is a public thing, no opinions, period.
Right, it's
Can you
just
mention-
what's being brought up as,
You know, you can bring it forth, but
Right.
yourself or us, or you can't do that opinion part, which
Right.
you didn't.
Right.
You know, I went through Jed and I went through everybody and they said you were fine,
Yeah.
but it's this close to having a problem,
Right.
especially if it's on, county service provider stuff. If it's on your own personal email, it doesn't matter.
Right, you can't
You mean
lobby.
expressing an opinion about.
Yeah, you
the-
can't
Right, you
express-
can't tell somebody to vote for this.
You can, you can say this is a health issue.
Yes.
Contact your representative, which is what you did, which is fine, according to what I was.
Oh, that one, yeah.
My sources of checking this
Yes.
out. I know we have to be very cautious of that. You know, and then we, as a commission, or Board of Health authority, the Board of Health has to have it on their agenda, then vote on it, and do it before the Board of Health can do it. But individually, Tom and Sue and all these other people, they can do it individually, call and vote. So, go ahead.
Let me put a little caveat on that. You can, like Tom Rice, you say county commissioner?
No.
Yeah, you can.
Well,
Maybe not with you, sorry. I can say mayor, because I'm not a board.
Yeah.
So and that's what I've done. I called up and voiced what I
I
thought
don't even know
as
what
mayor.
we're talking about.
House Bill 21.
Yeah. But the city county health board members should be very careful, and I didn't say that I was a city county health board member. You can't say, I'm part of the city county health board,
Yeah.
because you've just broken the law.
You can't.
If you try to influence,
Specifically use the,
Unless
answer
the-
things as an individual.
unless the board votes and says, please, we're assigning so-and-so to talk and put our concerns in, that's covered then.
Yeah, which you did well. You didn't indicate that. You know, obviously, coming from you, there's people that think, well, that's your profession, so you probably have an opinion. But you didn't come out and say it, so you're okay.
Oh, I'm acutely aware of.
We have to be very careful about that.
You can
in
educate,
all of
but
it.
you can't give an opinion.
Well, and you just hand them it. You don't educate verbally. You just say, go to this source and you read it.
Oh, you can educate them.
Well, boy,
That's what they're told.
really great,
Yeah.
really great.
Just tell them facts.
I was
Anyway.
with the local legal over here, Jed. He said you can't educate, basically. You can hand them the paper and tell them to go read it.
That's completely different. You can tell them that. Whatever.
But anyway, go ahead.
So I just wanted to bring this up, just so you're aware, there are two House bills regarding a Board of Health Authority. One is, I didn't know there was two, I thought there was only one, but there's House Bill 121 that says an act revising laws related to local boards of health requiring that certain rules, regulations, and fees be proposed by a local board of health and adopted by the governing body, allowing the governing body to amend a directive, mandate, or order given by a local board of health during a time of emergency or disaster, allowing a government body to amend an order given by a local health officer during a time of emergency or disaster. So that's what this one is. You can go on and print them out if you like. The other one is House Bill number 145, and it's a bill for an act entitled an act allowing the local board of health to issue recommendations for compliance with public health laws, rules, and regulations, and amending section 50-2-116. So you guys can go on and look at those and do whatever you want with it.
But we have to say that we're not, as an individual, what our opinion is.
Yeah, just
State your name and where you can go.
and where you go. That's just about when you're involved in public money, basically.
And I do know that like Tom Welch, if you want to speak with him, he does like text, because they're fast and you can see them all the time, so texting Tom, I think,
So, Jeff,
probably
they all
also,
do it,
yeah.
except for Conrad. I get sprained thumbs. What do they call it, bursitis, arthritis? I've had that stuff since it came out. So, okay. Is there anything else for the board before I move into this discussion action? Before the board or on the Zoom? Montana left. So I'll get back to the Zoom here in a minute, if you got a comment. Or my technical, I didn't see her leave. She left, maybe the clerk, or maybe Carly called.
She had something to do.
Anyway, okay, old business, approval of the December 9 minutes.
So approved.
So do we have a second? Okay,
There's corrections.
do you have a correction for the minutes?
Jeez, I just got it. Under where it says members absent, you have Carol Kennedy. She's actually a technical advisor. She's not a member. And let's see, there was, just on the back page, it was just a typo. And in the first sentence on the back page, it says the first tiers of vaccine, it should be TIERS.
Thank you.
So it could be tiers, TEARS.
Could be. That's some people
Where do they stick me?
Yeah.
I've been stuck a lot. Anyway, approval of the December 9 minutes with changes. So moved. Do I have a second?
Second.
A second. Got that, Cindy?
Got it?
Okay, all in favor say aye.
Aye.
Opposed, same sign, motion passed. Okay, I've got public discussion and comments on subjects. While you were out, I've asked, is there anybody else that has your hand raised or anything? Thank you, thank you. Okay, public discussion and comments under Board of Health jurisdiction, not on the agenda. Does somebody have anything? On the Zoom, is there any public discussion? Hearing none. Okay, this meeting scheduled for next meeting tentatively, and I'll try to have it here again. And what I'll do, just to reiterate probably what I already said, the Zoom will be available, and I'll get with the judge, and we'll probably next time we have it here, you'll see marks on the pews and a capacity limit in a sense. We'll count the X's or marks, and we'll go from there. So, and is there a date that you anticipate we need another meeting?
I thought we were doing February 3rd.
Yeah.
And
Well,
then we just set a date after that.
that's just for the community intervention implementation plan.
Well, that's okay, and then at the end, just add on, we can do the old business and the meeting schedule.
Well,
Because
okay.
it'd be a regular meeting of the city county health board.
Do you want to do that? Is that, if we can get all that in about 2 hours, think so?
I'm hoping less.
I hope so.
All right, because you're 10 o'clock and you better basically, even if it's not at the school, you got to be out of there by noon. Probably in that room, I can get all that, that's just their schedules for that room and that kind of thing. So if you think you can get it, we'll go February 3rd. And then we'll get some on the agenda for February 3rd. Can we just use this same number 4 that we used here? And we'll just, and
Number 4.
and then number 4, and then take off and go with what may come available. Okay. So I guess we could just go to the Board of Health meeting on February 3rd at that 10 o'clock and to be announced location. Okay, new business. Any new business out there? Anybody on there? Goodness sakes, people are getting tired of me. Okay. Motion to adjourn.
So moved. Okay, yeah.
I'll let her have the motion.
Okay, thank you.
How do you like that? I've never had one of those.
Wait very long.
Say aye.
Well, thank you for having enough interest in that to dedicate a whole meeting to. I appreciate that, because I'm brain dead on trying to switch gears to that.
Going on now at Stevens Greenhouse and Floral, the final days of our holiday clearance sale. Bye.